Hello, my name is Zaila and I'm here with my colleagues Kassandra, Cameron, and Eunice. Our team will be presenting about a rare birth defect called Schizencephaly, specifically on the unilateral cleft. So Schizencephaly is a rare developmental birth defect. This causes abnormal slits, also known as clefts, in the brain. If the slits appear on both sides of the brain, it's called bilateral clefts, but today we'll be focusing on unilateral clefts, and this is when the slits appear on one side of the brain. These clefts are often filled with cerebrospinal fluid. The picture shows how much a normal brain differs in comparison to a brain with Schizencephaly. So there are two types. On the left, you'll see the type 1 closed lip cleft, and on the right, you'll see the type 2 open lip cleft. The exact cause of this condition is unknown and not clearly understood, but people have genetic and vascular theories about causes. Some links it from certain medications or infections, and some people have mutations in one of the genes below. Doctors will use an MRI to diagnose this condition.
Some of the symptoms include seizures, intellectual disabilities, microcephaly, hydrocephalus, and hemiparesis. However, the severity and presence of these symptoms depends on the size and location of the clefts within the brain. In addition, the symptoms present similar to a stroke, like hemiparesis, and therefore there's a potential for functional recovery if addressed early. The prognosis for this population is positive, and they can live a long life if their deficits are addressed early.
Some of the risk factors that increase the chances of schizencephaly are being a young mother, genetic mutations, having a sibling or an identical twin with schizencephaly, exposure to certain medications or infections that disrupt the blood flow to the brain while in utero, or being involved with a consanguineous marriage. Our client is a 5-year-old diagnosed with unilateral schizencephaly. She presents with right hemiparesis and prefers to use her left arm. She has mild delay in gross motor and developmental milestones. She has a history of generalized tonic seizures that are currently managed by medication. She has mild intellectual disabilities, language deficits, and visual challenges.
So the next clip shows our client, Amory. She communicates with her family using different strategies, and her family is extremely supportive and in tune with her emotional and physical needs. We highly recommend that you take the time to watch this whole video in your free time.
Oh, Emery loves to read books. That's probably one of her favorite things in the world.
Can I check to see if she'd let me read her a book? Sometimes that brightens her up.
Yeah, of course. Oh, she picked your book. Oh, hey, do you want Grandma to read you a book?
You want to turn the page? Okay.
Yeah.
My grandma is my bestest friend.
Yeah, isn't that neat?
We love to play together.
Mama. Do you want to see Nana?
Mama.
Mama. Does she ask for her Nana a lot?
Yes.
My grandma is my bestest friend. She always makes me giggle. And when she sings and plays guitar, I always start to wiggle. Do you want to turn the page? Okay.
For an individual living with schizencephaly, there may be differences in presentations of the common symptoms throughout their lifespan. For example, during infancy, seizures may present as infantile spasms. Hydrocephalus is also a common presentation at birth. Often during infancy, increased pressure in the brain will necessitate surgery to place a shunt to drain the excess CSF. During childhood, it is common for seizures to present before the age of 3. Children may be on medication or need surgery to treat their epilepsy. As the child grows, they may need to have a procedure to replace the VP shunt they had inserted as an infant. In adolescence and adulthood, late onset diagnosis of schizencephaly is also possible due to an absence of symptoms during childhood. Extreme headaches and seizures may start later into adulthood.
Although there is no known cure, prescribed medications can help prevent seizures. For cases with hydrocephalus, as mentioned before, surgery of placing a shunt can be an option. PTs, OTs, and SLPs can help people with schizencephaly through supportive management. This includes rehabilitation for motor deficits, intellectual disability, and seizure management. There are some precautions that should be kept in mind, such as seizures, so be aware of seizure protocol and the triggers. Keep in mind of the hypotonicity and the spasticity and the headaches, so make sure you have a conducive environment free of loud sounds. Make sure to watch for symptoms of obstruction or the infection of the VP shunt if they have the hydrocephalus. Schizencephaly can cause motor delay from the contralateral hemiparesis. There may be development delays in language, cognition, adaptive, and socialization skills. So these individuals may have difficulties engaging in all of their occupations, such as their ADLs, IADLs, play, education, health management, and social participation.
The client factors that may be impacted by schizencephaly will depend on the symptom presentation, which varies between the individual. Some of the common symptom presentations include hemiplegia, which can impact sensory functions, developmental milestone and motor delays, which can impact neuromuscular and movement-related functions, intellectual disability, which can impact specific mental functions, and language deficits, which can impact voice and speech functions. Additionally, the performance skills impacted will also vary depending on the severity of the individual symptoms. Some of the common symptom presentations include hemiplegia and developmental milestone delays, which can impact motor skills, intellectual disabilities, which can impact processing skills, and language deficits, which can impact social interaction skills.
So, if we go back to our case study, we can see that Amory is a daughter, a granddaughter, a friend, and a student. The way that she expresses these roles may look a little different. So, schizencephaly symptoms impact a child's occupational performance in play, socialization with family and other kids. And as you saw in the video, a good example of this was when Amory shakes her head and she is communicating that she's happy. Also, deficits in ADLs and school participation may require assistance from mom or environmental modifications. In addition, families like Amory's family, they are typically very busy. Children may go through multiple surgeries throughout their life due to seizure control and hydrocephalus. And also parents are usually the primary caregivers, and they have to take their child to more than 3 different therapies throughout the week. Also, depending on the severity of the child's symptoms, a child can range from total dependent to moderately dependent for assistance on self-care, toileting, dressing, and bathing. So the parent caregivers are at risk for caregiver burnout, and that is definitely something that OTs can play a role in. So our OT role and scope of practice. So we want to promote and support occupational engagement and development of children in areas of play, rest, and sleep, activities of daily living, education, and social participation. So we address delays in developmental milestones through play. We provide adaptive techniques and equipment, positioning techniques, and we provide caregiver resources, support, and training. And research shows that if families go to support groups, that their quality of life definitely improves. So we definitely want to encourage that to these families. And our goals and interventions are always family-centered and client-centered.
Our first assessment is the pediatric evaluation of disability. This assesses the functional skills, level of independence, and the extent of modifications needed to perform functional activities in young children. The age range for this assessment is from birth to 8 years old. The next assessment is the Pediatric Quality of Life Inventory. This measures health-related quality of life in children who are healthy, adolescents with acute or chronic conditions. This assessment is crucial for kids with chronic or severe conditions like Amory. The age range for this assessment is 2 to 18 years old.
So the frame of reference that we chose to be our primary guidance is the neurodevelopmental treatment approach. The reason why is because the neuroplasticity benefits are greater at a young age. So we want to make sure that we address those abnormal movement patterns that arise from compensating for the side with the hemiparesis. And we want to discourage those deep wells from forming. So if we address those abnormal movement patterns early, we can hopefully increase the functional performance, and we can increase the quality of the child's movements to engage in their daily occupations. Some other supporting frames of reference that we'll use throughout the child's intervention are Rude's approach to address the abnormal muscle tone that the child has, and also the biomechanical approach to increase the child's strength, range of motion, and joint integrity. But as the child gets older, we may want to switch to a rehabilitative approach to enhance occupational participation in more complex activities, such as like school participation. The child may need some assistive devices.
The first intervention for our client is hippotherapy. Hippotherapy utilizes horses' movements to improve postural control, attention, bilateral coordination, and more. A horse will take up to 2,500 steps over a 30-minute treatment session, giving the client 2,500 sensory and motor inputs. Some precautions to be aware of during hippotherapy for someone with schizencephaly is migraines and grand mal seizures if uncontrolled by meds.
Our second intervention is called constraint-induced movement therapy. CIMT helps prevent the use of the preferred arms and hands, and instead, it encourages the use of the upper limbs with hemiparesis. The outcome of the intervention is to help improve the neuroplasticity in their brain, and the ultimate goal is to improve the functional use of limbs with hemiparesis.
And our third intervention is cognitive orientation to daily occupational performance. So this approach is client-directed, and it helps the client develop cognitive strategies. We use a problem-solving framework during the intervention and the activities. We also use process questions to increase the child's awareness to the use of these strategies. Eventually, we want the skills and the cognitive strategies learned to be able to be transferred and generalized into all activities of daily living and into play and school participation. So the specific intervention that we're going to demonstrate in the next video is the goal, plan, do, check approach. All right, Amory, we're going to play your favorite game. We're going to roll this soccer ball into the goal, okay? I'll show you. It's your turn. Give it a try. Okay, good. That was a really good job. Do you think you can do something differently? Do you think you can throw it? Do you think you should throw it slower or faster? Faster. Okay, give it a try.
One example of an adaptive device that could promote occupational engagement for children with schizencephaly is a crocodile gait trainer. This is Reese, and he uses his crocodile gait trainer for functional mobility to get to and from the car to go to school and to play with his friends. Communication devices can also be helpful for individuals with difficulties with language. Before receiving her AAC device, Kylie, who is pictured on the left, used crying as her primary mode of communication. Now she can work on improving functional language to express her needs using an app called LAMP Words for Life, which gives her access to a wider vocabulary.
Other professionals that may work with individuals diagnosed with schizencephaly are physical therapists to address gross motor movements, speech-language pathologists to address language and swallowing, brain surgeons to place a shunt in order to treat hydrocephalus if it is developed, and finally, a schizencephaly specialist. Since schizencephaly is very rare, majority of the community resources are virtual. There are 2 Facebook groups that stood out to us. The first one is Schizencephaly Families and Support. This group has 676 members. And the second one is Schiz Kids Buddies with 1,300 members. Another online support group is called Beyond My Battle. This website has virtual support groups for individuals with a serious illness, disability, or a rare disease. There are also virtual support group meetings for families and/or caregivers.
That concludes our presentation, and thank you for listening.